Hello aspirants, I'm Indumati Karthikeyan from Inkara AIS Academy. Today we are going to see about the 6th December current affairs. The topic is the syndemic of tuberculosis and also the mental health. This topic taken from the Daily Edition. The topic comes under the issues relating to poverty and hunger, the populated issues. That is, first of all, the tuberculosis can impact a mood and mental health, especially when it becomes a chronic or severe condition. This can occur due to the various factors related to this. The stigmatic side, that is due to the fear of contagiousness, association with poverty, and also unhealthy behavior. This lead both social and self stigma, which lead to the mental health challenges. The mental health issue lead to the hopelessness and also the despair and also the impaired decision making skills. That is a first and foremost is the physical impact that TB often causes a fatigue, weakness, and also chronic pain, which can contribute of the feeling of frustration, stress, sadness, and also irritability. And also there's the isolation because of the contagious. The individual may be required to isolate during the treatment. Social isolation can lead to loneliness, anxiety, and also the depression. There is a stigma. TB is often associated with the social stigma, which make individual feel ashamed or rejected, further impacted the mental health. And also there is a medication and side effects in the TB medication, isosonized reforming, and also that can cause the effect of the affect mood and such as irritability, anxiety, and also the depression. There is a stress of diagnosis and treatment. Coping with the long-term illness like TB can be emotionally draining, leading to stress or mood changes. If you someone who know is experiencing mood change while dealing with the TB, consider reaching to the healthcare professional for physical and mental health support. Treating both the physical and emotional aspect of the disease is important for the recovery. And also there is a wide range of addressing these issues. For psychological support, we need to provide the counseling therapy, and also we need to give the support for the emotionally, morally. The psychological challenge will be overcome by the moral development, and also the community education to reduce the stigma through the awareness campaigns were essential, creating the supportive environment, and also integration of the mental health service into the TB treatment provides a closure of holistic care is the important thing to recover from the mental health. And also there is a national TB elimination program can be provided in the India, that formerly is a revised national tuberculosis control program, flagship program of TB control and elimination. It eliminated to a TB by 2025, that is a global target by 2030. But free diagnosis and treatment for all the TB patients provided by the Indian government. And also there is an active case finding campaigns also formulated. Integration of private sector healthcare providers also jointly overcome to these issues. And also use of directly observed treatment short course strategy. That is a diagnostic, that is a main important criteria, that is subtle microscopy, quick and cost effective, and also gene expert like molecular test, and also detect the TB and drug resistant within hours. Also chest x-rays used to identify pulmonary TB, and also cultural test, that is a good gold standard of confirming TB, although it will take a longer time. So we need to conclude the time limit. And also TB treatment regimens is something World Health Organization recommended guidelines. Also the involve the standardization of the drug regimens, that is a drug sensitive, that is 6-month course using the first line drugs such as isoniazid, reformin, pyrazinamide, and also the ethamabrabutol. And also there is a drug resistant second line treatment with drugs with the bedaquiline and also delamamide and also line solid. There is a regimen lasts longer of 9 to 12 20 months depending on the resistance levels. And also the patient's support is required. That is Nikshai Poshan Yojana, a government initiative, rupees 500 per month for the TB patient for nutritional support during the treatment. And also there is a providing the counseling services, and also keep on monitoring the follow-ups of the community health workers, and also the track treatment programs to prevent the dropouts. That is a private sector involvement also required, that is a diagnosed and treated in the private sector. The government collaboration with private healthcare provider to encourage notification of TB cases, and also standardize the treatment regimes, and also provide the TB drug to private practitioners. And also tackling of drug resistant, that is India's a significant burden in the multi drug resistant TB, MDR, TB, that is extensively drug resistant, that is a specialized treatment centers as the use of newer drugs like bedaquiline and also dalamine or the part of strategy the government has expanded access of shorter and more effective regimens of the MD or TB, but we are having the challenges behind that. There is a stigma and awareness, treatment dropouts, and also the co-infection with HIV, and also there is a private sector variability. These are the major challenges that is we come to overcome, and also there is a new innovation technology. There is a Nikshai portal, a design platform track the TB patient monitor treatment and also ensure the case notification, and also AI and machine learning used for TB screening and also diagnosis to in remote areas. There is a mobile health interventions, SMS reminders and apps also support the treatment in adherence, and also there is a international collaboration also there is a participation with organizations like WHO Global Fund also stop TB partnership strengthen India TB's control effort. India also works on research and development through the TB drugs and also the diagnostics of the vaccines. These are the major steps taken by the Indian government to overcome the tuberculosis, and also we need to focus on the mental health care of the tuberculosis patient. Thank you so much.